Hello everyone and welcome to my channel. So this video is going to be about how I passed the next generation NCLEX in 85 questions. So I am just so relieved to say that. I'm going to take you guys back to the beginning, kind of like my nursing journey, and just share with you guys different things that the school did to prepare me for the next gen. So let's get started. So I graduated from an Associate of Science in Nursing program, which started in the fall of 2022, and I graduated in April of 2024. So it was almost a 2-year program. So the school prepared me by incorporating the next generation NCLEX question styles into our exams. So like the matrix, the bow tie, the drag and drop, those were type of questions that we would see on our exams so that we could be familiar with those and learn how to answer those. Because if I was taking the NGN and I had no idea about these new type of questions, I probably would have been like, well, what do you want me to do with this? Because what? So I'm just so very glad that we were exposed to that we were kind of taught how to answer those. And in tutoring, they really helped as well, because some of my classmates struggled with what's the difference between non-essential and contraindicated, could this be this or that? And so that really helped them really break down those questions and answer those to the best of their ability. So my NCLEX studying started April 2024 because that's when our practicum started. So I only did 90 hours of practicum, so I had free time the rest of the time. I wasn't working, wasn't really doing anything because I'm trying to focus on school, and my practicum was in the PICU on night shift. My first choice was NICU, but I'm glad I at least got PICU because it's close enough to what I want. So, and I got to see some cool things and do some skills, and just, yeah, it was a good experience. So I started studying a little here and there when I could. In April, I had a calendar for April and I wrote out my study plan, but I did not follow it because it was just too in depth. I was going off one on Pinterest and kind of or something, and it was chapter this, trying to do different systems and different types of nursing, peds, mental health, different days. But that just didn't work for me because with having practicum, trying to adjust my sleep schedule because I hadn't worked night shifts since December, it was a little rough. But I did study when I could. So yeah, but also we were required to do VADI, which is virtual ATI. So that was maybe, I don't know, the end of March until graduation, or until you finish it really, because it's a 12-week thing, but you can get it done sooner if you really work through it. And personally, I'm not a big fan of ATI because they humble me over and over and over again. But I've learned to love it and learned to utilize it to the best that I can because I'm paying for it, so why not use it? And it's there. So I did that, and I did some board vitals and dynamic quizzes, and I think learning systems, which is kind of under dynamic quizzes. So I utilized those during the month of April and some of May. So that's kind of what April looked like. Practicum, studying here and there when I could, and doing ATI. And also I joined a Hearst review, which was free, and the first time I joined I earned a free 1,500 question bank. So I also did that during the month of April when I had time. I tried to do I think it was 50 questions a day. I did not do 50 questions a day because that was just too much. And I mean it was a good resource to use, but it was really just practice questions, which I think practice questions are super helpful. But yeah, that was that. that's what my April looked like. Practicum, VADI, Hearst Review, QBank, and studying, you know, a little bit here and there. I can't remember exactly, you know, if I picked up a book or what. So come April, I made another calendar, which is also in Burn, and I was looking for it and I can't find it, but I did like week by week of what I wanted to study, and I wanted to utilize one resource each week, so not using two. But then I also like incorporated where I would do one for the week and then start another like resource halfway through the week, you know, just to kind of not cram, but because I thought I would be taking my Nclex the week of the 20th. That was not the case, which is fine because, you know, things happen. So my nursing license application was taking forever. I sent my transcripts, you know, I sent them by mail, then I sent them by email, and then I was just calling and trying to figure it out and say like, you know, my application is still processing. When could I expect it to be completed or ready for, you know, whatever. So this one day I called, I can't remember, maybe like, I don't know, mid-May. Before this, I called a few times about my application, and they were just saying, you know, we got a great influx of, you know, applications and transcripts that we're sorting through. So I understood that because people are graduating, and that's just, you know, that's what's going on. So I know that they probably have a lot of papers to go through and things to sort, so I just try to stay patient. But then I called one more time, and she was able to like process my application because my transcripts were in, and, you know, do whatever she had to do so my application could be complete. And then I got my ATT like 4 hours later that day, and then I signed up for my Nclex, and I signed up to take it May 28th in the state next to me, which I was like, okay, well, if I have to drive an hour, you know, whatever, even though I would rather not. So my test date was May 28th, and I checked, like, not every day, to see if there was any cancellations and see if there's any openings closer to the date that I wanted to take it, or in a city near me that I could take it. And I think it was maybe Sunday, the 26th, that it opened up for a city near me, the 28th, at the same time, which is 1 p.m. that I had scheduled. So I went on that and I rescheduled, so I only had to drive like 25 minutes rather than an hour. So yeah, that was so much more helpful because I didn't need the stress of the drive to drive an hour, because road rage is real. But so I want to share like the resources that I utilized for May because I think I just kind of got off track and talked about like me scheduling the Nclex. So May, I can't remember what week was first, you know. I utilized free trials, UWorld, Archer, Hearst, I think. You know, I'm not sure like which one. One of them I didn't really use. Maybe it was, and I think Nclex-Rn. It was like one of them I didn't use as much because there wasn't much to use, or I don't know, I don't remember the situation. And I can't remember which one it is, but just to put that out there. So I did week by week, and I can't remember, you know, what one was first, but I'm just gonna start here. My school provided this book, the Comprehensive Nclex-Rn Review, and I forgot to share, of course. So also during May, we did a 3-day of ATI Live review with this book, and we went through, I think, pretty much it all, which, you know, it's pretty lengthy, but the back has like different activities you can do and like the practice questions. So yeah, we did those activities like at home and then with the instructor that was doing the ATI live review, so like a crossword puzzle. And yeah, but I utilized this book throughout May. Yeah, I might have started like after I graduated actually, because I had this my first day of the ATI live review, which was like the 22nd, I want to say. Yeah. So this was helpful, surprisingly, because it's ATI. I kind of just like skimmed through it all again. I didn't go in depth on some of the things like oncology, just like things that were, you know, like, did we learn this? Some of the stuff we didn't learn in school. There was just not enough time. And then the pharmacology section was really helpful, even though like it's not a comprehensive review, even though it is a comprehensive review. Like, if you get what I mean. Like, it doesn't have everything in it, which obviously, you know, it would be much more bigger if it did. And then I started to do section by section. So there's like fundamentals. So I would do the fundamentals assessment, and then I would do the once I finished the fundamentals assessment, whether that be 1 day, 2 days, 3 days, then I would do the practice questions at the back. Let's see. So I do that with each section just to like kind of gauge where my knowledge is and to see where I'm lacking in information and understanding. So yeah, I feel like that was a good way for me to go about studying, because let's see, I'm trying to see how much questions. Oh, I guess it might depend, because the med-surg one has 18 questions, and you know, they have like little pictures, and it was like select out apply, put these in the steps, like place the steps in selected order, which I'm not really a fan of. Fundamentals had 20, so it all really depends. And then what's also nice is that this had a comprehensive assessment, and that was, how much questions was that? 45. So I just sat, you know, and answered it, and then I would like check my answers and erase the ones that I got wrong, or if I did select all and like I missed one or something, I would fill it in, you know, just to kind of like gauge where I'm at with this information. So yeah, this book was helpful. I went through this whole book, even though I skipped pages like or sections. I try to focus on my weak areas, like that I found out were my weak areas during VADI. So obviously mental health, and then surprisingly like peds was a weaker area, probably just because when I took my peds assessment for VADI, it was not a great day. I was not feeling well. I was just, you know, not in the right headspace to take it. So yeah, I use this. And then also I have this that I got from Amazon, from Kaplan. It's the Next Generation Nclex Prep 2023 to 2024. So there's practice tests and proven strategies, and I utilized this during the same time that I utilized the free trial, and I feel like that combination was so helpful. Like, I don't know what it was, but it was just helpful to kind of get two different resources, or two different like forms of Kaplan, so like the online and then, you know, physical, because I prefer like physical books rather than online books. So this is more like a how you I don't know, maybe it's more like how you could answer these questions. It has a lot of good like rationales, practice questions, trying to figure out like, how do I answer this question? Like, this is just so helpful. And then also has this, but I didn't know how to use it, so I didn't. It's like a QR code for a test, but I did take a Kaplan test. Like there's free ones online. I'm not sure like how much there is. So it has like what is the NCLEX exam, the structure of the NCLEX exam, the NCLEX exam scoring, and the content of the NCLEX exam. So then it would separate. This is like safe and effective care environment, and it would tell you like how much percent of this is on the NCLEX, and then it will give you different subcategories about like what it entails. So like advocacy, client rights, informed consent, and then there's like practice questions throughout it, which I like, but like the answers are kind of like at the bottom, so I would try to like, I would not look because I wanted to like see where I'm at with like answering these questions. So yeah. And then it says like eliminate, it has like different steps, like eliminate this choice. Like for this question, I'm gonna read it out loud and then read like the different things. A client in a psychiatric unit asked the nurse, "Am I in a special radioactive shelter? When was it last checked for radioactivity?" Which response by the nurse would be most appropriate? So 1, this is a hospital and we do not have a nuclear medicine department here. 2, don't worry, you're safe, there's no radioactivity here. 3, I'm sure your safety is of concern to you, but this is a hospital. And 4, please share with me what makes you think there is radioactivity here. So step 1, eliminate answer choices. 1, they say, this response provides information, leave it in for consideration. And then for answer 2, it says, it has like the answer and then it says, this response offers false reassurances, eliminate it. 3, this response reflects the client's concerns about safety and provides information, keep it in for consideration. And then 4, let's see, this response allows the client to verbalize, but you don't want to encourage a client with a psychological problem to talk about hallucinations or delusions. Rather, you want to discuss to focus on the feelings that accompany them. Eliminate this choice. So there's 2 we eliminated, there's 2 that we leave in for consideration. So, you have more than one possible answer choices, 1 and 3. Look for the answer choices that reflect feelings and gives information. So the correct answer is 3. So like, it kind of like helps you with like test taking strategies. Like when you have 2 that you're like between, like, oh, which one is right? So like you could do that. Like it just gives it a different way to come about the question, to answer it. And they have case studies, oh, and chapter quizzes at the end, and they have like little case studies, so I really like that as well. And then it doesn't have like in-depth information, but it's like a quick review. Like if you feel good about one area, you could like review it, and if you don't feel good about another area, you could use another book or resource to go more in depth with, you know, looking at that. So yeah, they have NGN questions. They have, you know, the triad, I think that's what it's called. Select all that we all love. And then this one has a comprehensive assessment that is 150 questions. So I think it's like 140, I don't know, for the maximum amount of questions on the NCLEX. So that's really nice that they have that, because it kind of mimics test day, and it says like allow yourself 5 hours, take it in a quiet space, blah blah blah. So I definitely did that. I almost like didn't know it was there until I looked. So I think I did it the day before I took my NCLEX, because I made sure that I utilized the ATI comprehensive assessment as well, which was only like 50 questions. So, and then I also have this just notebook that I took notes in because I would take notes from those books. And then I also want to share that I use this much. I was expecting to use a whole thing because I'm a note taker, but I just use this much. But I utilize YouTube. I have a playlist that has like 130 videos, like not from the same people, but like from a variety of like clinic reviews, registered nurse, RN, simple nursing, different crash courses that I didn't even like listen to because it was just too long, like it was 4 hours. But I would obviously split it up, whether it's hour increments or 20-minute increments, whatever it may be. But I just didn't watch those because I really thought the thing that was most helpful to me in that playlist was the clinic reviews, and it was Dr. Sharon. She has, well, I think just clinic reviews in general, but I just watched her. The test taking strategies are so helpful, and she's like so real. She's like, just use your common sense, and that's the truth. Because, you know, some of the questions you can use your common sense. You don't need to like analyze it. Like, it's just like, okay. And then other questions you have to use process of elimination or just like talk yourself through it. So if I do this for this patient, is that, you know, the best outcome? Or is that appropriate for them? And I watched so much of her videos. I don't think it was all of them, but I feel like it was a good chunk, maybe more than half of what she has available, and they're free. And they also have like an online review that I didn't purchase. I didn't really purchase anything because I'm trying to save my money. But yeah, so that was so helpful. I think that's the thing that, well, I feel like it was a combination of everything that helped me, not just one specific thing, because I learn by reading, writing, and doing, like, and hearing. So, and then one last thing that I utilize a little bit, which this is just so much information, is the Saunders Nclex-Rn examination. And you see, like, it's just so much, which is a good thing, because if I was unsure about something, like if some med wasn't in one of my books, like a side effect or an adverse effect, I would look, you know, in here, or a different disease process. And this also has practice questions at the end of each chapter, and it's just so amazing. Priority nursing actions for paracentesis. I thought this had the thing. They have little tables, side and adverse effects of antiviral. And another thing that Dr. Sharon from Clinic Review said was side effects are things that we treat. Adverse effects are things that we like stop the med and call the doc for, which really helped me to kind of like see, like, is this a side effect or is this an adverse effect? And yeah, so that gave me another like way to look at things. And, you know, am I going to call the doc because someone is having nausea after taking the med? Like, depending on the med, or, you know, whatever it may be, we manage side effects. We manage them. So that's what I really learned from her, and she was just so insightful. She does reviews, she does practice questions, and that was really helpful. And then also, I don't know if it was UWorld, they did like question drills, and that was also helpful for me because it was like interactive, but also I could pause the video if it wasn't live. Yeah. And this is like split up. There's like pediatrics, endocrine, pediatric GI, pediatric eye, ear, and throat, pediatric respiratory, cardiovascular. Like, it really is so comprehensive. This is so helpful. I should have used this more in nursing school because I think it would have really helped me. Because it's all there, you know. You don't have to bring all these different books, like, to study. You just have it all there. But yeah, that is how I passed the Next-Gen Nclex-Rn exam. And if I can do it, I believe you can do it as well. You just have to like take out the time to study and really understand what you're studying, and you'll be good, honestly. I did study for like hours a day. I didn't time myself, but I know it was long. And you know, it felt like all I was doing, really. Just sitting there studying, but I would also like get up, go on the treadmill just to get like blood flow moving and circulating so I don't get any DVTs or anything. But I just wanted to also be active, and yeah. So I want to talk about like leading up until my Nclex. So how I said I studied like hours every day, pretty much. Well, we had a grad sale the weekend before my Nclex, which my Nclex was on a Tuesday. So during that grad sale, I was very a part of it, and I studied a little, like less than what I did on a normal day. So I kind of just gave my brain a rest. And I definitely did that if I felt like I needed a rest day or rest hours, because you have to follow your body's cues. If it's telling you to stop studying, you know, if you're getting a headache or if you're feeling like sick, just take a break. There's more time to study. And just really give yourself care, you know, really prioritize self-care and just taking care of your body. But also, like, I'm going to talk about the day of my Nclex, which since it was at 1 p.m., I was like, what am I going to do? Like, I wake up at like 9 maybe. What am I going to do for those hours? So, I ate a nutritious breakfast. I didn't drink coffee. I kind of like mimicked my exam day routine that I had in school. The night before, I drank 2 bags of mint tea. And then the day of, I drank 2 bags of stress tea. And then I drank water, like just trying to stay hydrated. So I had that. I had stress gummies. I have essential oils that I was diffusing, and I put like on my temples, behind my ears, and on my wrist, which it was like lavender and tea tree oil, because my peppermint one is kind of like running out that I use throughout school. So yeah, that really helped me just to have a clear mind. And I would also just diffuse that if I was studying in my room, just to like help me retain information and to concentrate, because I find that to be helpful. Like just breathing in essential oils, like there's some type of scientific behind it, and it's just helpful when you're studying or you're about to go take a big exam. And also I wanted to include that I passed in 85 questions, not because I thought I did. When it shut off, like I was watching, when I was at like 70 something, I looked, I was like, I'm almost at 85. I wonder what's gonna happen. I was scared. And when it shut off, I was like, no, don't leave me now. And like me and 2 other girls like got done around the same time, and me and this one girl just exchanged a look like, oh great, because you know I wasn't very confident, and it was hard to wait like 22 hours, almost a day. I did not sleep the night I took my Nclex. Like I would get up while I slept, but not great sleep. I would get up, remember questions, look in my book, look them up, see like what, like if I got it right or wrong, try to do like, okay, did I pass, did I not? And we know that it's like a pass or fail, it's no like score, so there's no way to do that, like to figure out if you passed or not. The only way you know is if you got your license or whatever it may be. So then I was like cleaning my room, listening to music, this was the next day, like 11 something a.m. I think. It felt like so long. I think it was it was the next day. It felt like so long, like those 22 hours that I waited. So I was listening to music, and I was gonna like save a song on my Spotify to a playlist, but I guess it was already saved. And I got a notification, license issued, and I didn't want to look at it. I just like put my phone down. I was like, what? Is that real? Like, I didn't look at it. I waited for my mom to come home so we can all look at it together, and we did, and my license was active. And I'm just like, I did it. Like, I didn't cry, but I thought I would. And then my unofficial results like were available to purchase a little after my license was posted and active and issued. But I was like, do I want to do that? Like, part of me wanted to, because I would look up like, I got my license but not my results, and then I seen someone said like they failed but they got their license, and I'm like, oh no. So that kind of made me nervous. So I actually decided, I think a few days ago, to purchase the results just to look, just to have like confirmation. Like, I know a license is full confirmation that you passed, but I just wanted to see the word pass, and I couldn't wait 6 weeks for them to like give it to me for free or whatever. Like, I wanted to wait, but at the same time I needed to see it for myself. And I seen pass and I was like, I really did it. Like, all this hard work is paid off, and I was just so proud of myself, because it wasn't easy getting here, and I'm just so close to my dream. And yeah, I want to keep you guys updated on what comes with work and when I start like my BSN program online in the fall. So yeah, definitely stay tuned. I should be hearing back from some jobs this week, but I'm just gonna keep quiet until I do hear back. And I'll definitely keep you guys updated and bring you along this journey. And I'm sorry that I didn't, like with school. It was just kind of me trying to figure out ways to be successful, because it felt like we had exam every few weeks, if that, maybe even back to back. And I was just always studying. I was always on tutoring. I was always just go. And now it's like finally calmed down a little. Now I just need to wait to see, to hear back from these jobs that I've interviewed for, and then maybe I'll just be able to take a big deep breath and just relax for a minute. I'm so proud of myself, and thank you for watching. Stay tuned for some future videos, and I hope you guys have a great day.